Dr. Johanna. I'm Dr. Madeline, and we are the awesome chiropractors at Atlas Chiropractic Center. Yeah, welcome back for video 2. What we're going to talk about in this quick video is our experience personally with jaw pain and achiness and issues, and then what are some things that maybe your other doctors haven't looked at with why this is actually going on for you. Yeah, so my experience is I actually did some additional training in this type of work with the jaw and pain because a couple years back I had that pain. I think it was from stress. My jaw was really tight and I needed a different way to manage it because the things I was trying wasn't working. And then I was actually very thankful that I took that because after having my baby, it got significantly worse, and I think it's the lack of sleep and the additional stress that happens. I mean, there's some mornings I wake up and I know I've had you work on it for me, I can barely open my jaw and there's just so much pain through here. That's my experience. I've had jaw aches and pains for a couple of years now as well. I think it's heavily stress related. I've also been in a couple of car accidents, which do not help it at all. It definitely flared up after my last car accident. And just having to take the time to manage with different doctors, co-manage with dentists, and do some different things on my own, which we'll get into a little bit later. But I will tell you, and I'll be completely transparent, one of the things that I was given was a night guard that I paid for and that I've used probably less times than I can count on one hand. So just being transparent on that, I'm not even as compliant as I should be with that. So what are some other options that actually help me manage this? Yeah, and so it's important to note that we do have some additional training in this realm, and part of that is to co-manage with your oral care provider, so your dentist or whomever you're working with. But there is always a missing link, I feel like, on why people aren't getting as much of a change or results that they're looking for, and that's because the jaw and the neck basically play together. I mean, that's the easiest and most simplistic way I can put it. The motion that happens here on how you move does affect how the jaw opens and closes and how it tracks from side to side. So there are there's ways that you should evaluate that in both areas. Even if you don't have neck pain, you should still look in that area. And then so therefore there is a specific treatment protocol that should happen based on what your results are with that exam that actually happens. And that's what we have training in. We're special trained in that.
So you're saying that it's not always just the jaw joint, we look at multiple things here.
Yeah, absolutely. It's a huge biomechanical thing, right? So how you stand, sit, stress, all affects that.
We just want to hit that home with you because I think across the board, we just look, a lot of our mainstream medical model looks at one spot in particular, and if that has worked for you, then great.
Awesome.
But if you're watching these videos, then maybe that hasn't been your case.
Sure.
Everything's connected in your body, so we're going to look at that as a whole and how to actually help you get moving past that pain with that in our mind as we're doing that.
Yeah, absolutely.
All right, so stay tuned for the next video where we're going to give you some tips and tricks that you can do on your own at home to help alleviate some of that